Effective immediately, Ontario is declaring a state of emergency. We expect this to remain in place for at least 28 days. Further, I'm issuing a stay-at-home order effective Thursday at 12:01 a.m. Under this order, everyone must stay home and only go out for essential trips to pick up groceries or go to medical appointments. Based on the advice from the Chief Medical Officer of Health, schools in Windsor-Essex, Peel, Toronto, York, and Hamilton will remain closed for in-person learning until February the 10th. By January 20th, the Chief Medical Officer of Health will provide recommendations for the remaining regions. As I've said from the beginning, when it comes to our children, I will not take any unnecessary risks. I need you to do your part. Stay home, save lives, protect our healthcare system. The system is on the brink of collapse. It's on the brink of being overwhelmed. We're at levels we've never seen before. Last week I stood here and I told you that our province is in crisis, and the facts are clear. Cases and deaths are at the highest levels since the start of the pandemic, and community spread continues to escalate. The dangerous and very dangerous UK strain of COVID is being found across the province. Ontario had 8 new cases confirmed today. And if we don't move fast, our hospital ICUs could be overwhelmed by the first week of February. The success of these measures will ultimately depend on you. It will depend on each one of you, because without all of us rowing in the same direction, this thing could get much worse. Just look at what's happening in countries where the UK variant has taken hold. It's a total disaster. And we've been told by officials it's not a matter of if this new strain takes hold, it's a matter of when it takes hold and how wide it spreads. My friends, this situation is extremely serious. I just can't stress this enough. But unlike back in March, today we have the vaccine. It's on the horizon. We have hope on the horizon. It's in sight, it's within reach, but we need to give that vaccine the runway it needs. We need to get through the next few months because the vaccine rollout is tied to supply. And based on the current delivery schedule from the federal government, we're still months away from the millions of doses we need to start getting critical mass of people vaccinated.
Declaring Ontario's second state of emergency in response to COVID-19 is not an action we take lightly. We are fighting the spread of a virus that has once again led us to the brink of a health crisis. This is an emergency, and we are treating it that way. We have been upfront about the severity of the threats we face if the numbers begin moving in the manner we have seen during these past days and weeks. We have said we would not hesitate to explore and exhaust all options necessary to protect Ontarians if the situation worsens. And it has. We are declaring this provincial emergency to allow for stronger measures to reduce the spread of COVID-19. And these measures will be enforced. A greater authority will be provided to enforcement personnel across Ontario to ensure restrictions and orders are followed.
This virus is having real impacts on families, on our businesses, and on our communities. That is why we are introducing additional public health restrictions to strengthen our province-wide shutdown measures. As you heard from Dr. Brown this morning through his modelling update, we must change our mobility patterns. Too many people are having too many contacts. Increased contacts result from increased mobility. So, to break this cycle, you must stay home as much as possible. And that starts with a stay-at-home order. As part of the stay-at-home order, we are asking businesses to ensure that any employee who can work from home does work from home. All non-essential construction will be closed. All non-essential retail stores will be required to close by 8 p.m., with the exception of grocery stores, convenience stores, pharmacies, and restaurants providing takeout orders. Outdoor gatherings will be further restricted to 5 people. Wearing masks will be mandatory in all public places and should be worn outside as well when you can't keep 2 meters apart. School closures in Southern Ontario are being extended until January 25th and will be assessed on an ongoing basis by the Chief Medical Officer of Health. We are also expanding rapid testing to help identify and isolate cases of COVID-19. We are doing this by providing 300,000 COVID-19 rapid tests per week to support key sectors such as manufacturing, warehousing, supply chain, and food processing, as well as additional tests for our schools and long-term care homes. We expect to receive nearly 12 million PanBio rapid tests from the federal government over the next several months, and we continue to pursue opportunities to purchase additional rapid tests. We also continue to implement our high priorities community strategy, and local lead agencies have begun to deliver key interventions in the province's hardest hit vulnerable neighborhoods. Together, these measures will help fight the spread of this deadly virus.